Live well and thrive. The future of wellness starts here. The movement transforming health and wellness worldwide. Live longer, move smarter, feel unstoppable.
Hi, this is Mike Torsha, and welcome to another episode of Live Well and Thrive. I have two amazing guests on. I have Eli Gabayan and Hana Ayoub. They're both from the Beverly Hills Concierge Medicine. It's an incredible medical group that offers medical services 24/7. And if you need a doctor to come to your home, you can have that. So welcome to the show.
Thank you.
Thank you.
I really love what you're doing. I know since probably COVID, this concierge medicine has really been in demand now, huh?
Mm-hmm. Absolutely.
Now, how long have you been doing this service?
So we've been doing the concierge service for a few years, but over time it's been expanding and evolving into more and more services for our patients.
So who was the person involved with? Was it you or Ari or Shervin that came up with doing the concierge medicine?
It was really Ari's idea in the beginning, and ever since then it's been expanding to the whole center and the whole group that we all of us supporting the whole program together.
Now, on your medical group, I'm amazed by what you have there. You have the complete laboratory there. Why don't you share all the different testing that you offer?
Sure, I'm happy to. Yeah, so we have a very complete laboratory test on site that we can get results very quickly for our patients. We don't have to wait a few days for the results. And we also have a very comprehensive imaging center. So easy access and fast access for imaging for CT, MRI, X-ray, ultrasound, and even PET scan. So we have all of those for our patients that we can, very quickly schedule. And these days it's become a real issue for patients to be able to get into an imaging center for the appointments in a timely fashion. So we're happy to be able to offer it quickly and with quick turnaround time.
Now, also you mentioned there's, I think, a whole body scan you do. What is that called?
So it's called the whole body MRI scan, where we scan from head to the mid-thigh, and we can screen our patients for any incidental finding that we may find.
Now we will show plaque buildup in the neck or the heart, or how detailed is it?
So the MRI is pretty detailed, but in terms of a plaque buildup, that goes a little further testing.
Cardiac testing.
Some ultrasound.
Well, maybe give you a heads up that there is something there.
It can give you a heads up, but the MRI in itself for the cardiac is not as good as our CT angiogram or the rubidium PET that really looks at the heart. So that's a whole different focus.
So if someone comes in and does that body scan, you go, you know what, we see in the imaging that there could be some buildup. Now let's do the following, right? Is that what you?
What we would do is based on the patient's history, family history and their own medical history, we tailor make, the testing for them. So, for example, we may combine the MRI with the cardiac test, just to be complete for that individual person. Yeah.
It depends on the patient's age, family history, what they're seeking a health screening for. We always recommend to do our diagnostic cardiac testing. We do CT angiogram, and we also have AI that could take the images from the CT angiogram to create plaque analysis and to give further information. It's one big thing that even the cardiologists all around us refer to our center for the imaging department to do.
Now, you had said to me earlier that you had a patient that came in just to do that whole body scan.
Oh, yeah.
Overall health purposes to make sure that everything is functioning correctly. And what did you discover?
So I always rave about this type of proactive medicine to all of my friends. So I was talking about it in a group of mom friends one day, and then one of them was like, sign me up. I was like, okay. So we did her whole body MRI. We did a cancer test, which is through blood. We did the True Age True diagnostic test. We just tailored something mini, something small, because she wanted to know more information about her health because she lost so much weight. She's gung-ho in the gym. She's all proactive, right? We actually found a 29.9 millimeter tumor in her brain.
From that body scan?
From the whole body MRI, and she had no symptoms. So when the interventional radiologist called me to tell me, Hannah, I found something gnarly, I was like, oh God, please don't let it be my friend. So it was like a whole thing. And so now she's on a different journey. And Dr. Ari and Dr. Eli know a group of, highly skilled specialists in our area. Of course, Cedars-Sinai, UCLA, Hope. I mean, we have contacts everywhere, all around the world. And she's on a journey, right? To find out what it is. Should she get it out? What is the next treatment? What are the next steps? So overall healthy, late 30s, didn't even know she had it, no symptoms, no nothing. And we're glad we caught it now, that we can do something about it before something happens all of a sudden.
Well, this is game changing.
Yeah.
I'd like to find out more details because I want to recommend this to all my clients.
Sure.
Because look what you discovered, and if a woman didn't know it, she ended up having, the cancer take over her brain, and who knows if she's alive.
Pretty crazy, yeah. Especially with no symptoms. So a lot of patients are asymptomatic. So all of our specialty screening, depending on if we're screening for cancer or we do genomic testing, and our physicians are able to read those tests. Not a lot of physicians are able to read genome sequencing testing. That's a very, very skilled and trained thing that they get being in their board certification. So these are all things that people definitely should do that insurance, of course, doesn't cover, because insurance waits till you have symptoms or something goes awry or you're having chest pain or, they're waiting for more reactive care. And that's when it's way too late for, physicians to help.
But it's priceless. I mean, seriously.
Pretty much, yeah.
If something like that could be prevented from further growing, and this could help you handle the situation, because last thing you want is that tumor to hopefully not grow, but if it does and you don't know it's there.
Yeah.
Because, like for instance, with dogs, I've had a lot of my dogs die from cancer.
Oh, wow.
And it's such a shame. And if I had known that they had cancer, the vet told me we could have removed and hopefully saved their life, but unfortunately it was collecting, and we didn't even know dogs weren't showing any symptoms.
Yeah.
Especially dogs are very resilient from pain.
Sure.
They're like humans, right? So I think this would be something great. Can you actually scan it, Anna?
We can be happy for.
I mean, why not?
We do have the medication on site. We have a pharmacy, a full-on pharmacy. So we're able to order certain medications to calm people's nerves. Sometimes we have to do that for the whole body MRI. Or we probably could do that for a pet. That would be funny. We can.
I mean, listen, that's a whole nother industry. And there's 180 million people in the United States that have either a dog or cat or both. So, and look at these companies that make the fresh food for pets.
Yeah,
It's a $1 billion business right now.
So
So why not delve into the animal world?
Oh my gosh, imagine.
I'd come over because I love dogs and cats. I'd be over. Hey, who do you got over here today?
just to follow up on what she said, just because insurance doesn't cover something, it doesn't mean that it's not worthwhile doing.
100%.
So we have all this very good technology at our disposal. Why not use it if you have it? So, I do it for myself, for my family, for my friends.
We all did it.
If you have it and it's not risky to do, it's worthwhile doing.
100% prevention is everything.
Exactly.
I tell people come to me for many years and they put on so much weight. I said, if you had just did something about when you first start seeing the weight gain, you wouldn't have to go through all this starving, this excessive training and so on, because it ends up being a lot of work, and sometimes people don't want to commit to it and they just accept being overweight and out of shape. But I always tell people, for instance, I was working with this actress many years ago, Connie Selleck, and Connie and John, her husband Tesh, wanted to have another child. And I said, Connie, do yourself a favor. Start training now. Eat super clean. Stay away from any processed foods. Get healthy. Then get pregnant. What's so funny is that she later on got pregnant, like 3 months later after we did this aggressive program. She gained about less than 20 pounds. And then she shot a movie 3 weeks after she gave birth.
Oh, wow.
And had to do her shower, seemed very sexy. And she had the perfect six-pack. She didn't have a C-section. But she said, Michael, thanks to you, because otherwise, I don't know how I could have done the movie, because she had an agreement done a year in advance to do this movie. And she had to do it. And she was nervous. But the fact that even before she got pregnant, she prepared for it. I ran into Connie, and it's so funny, and her daughter. I hadn't seen them in over 20 years. And I remember holding this little baby up she was born. She's like 6 feet tall. She's this beautiful Pilates instructor. And she has this perfect figure. And Kai to this day still has that beautiful figure because she's never stopped following my steps of eating healthy, exercising daily, right? So prevention, especially when it comes to having tumors or anything else, or signs of multiple sclerosis or Parkinson's or Alzheimer's, whatever, that's a crucial tool. Now, can it detect anything like Parkinson's or Alzheimer's because of the brain, or it can't go?
So that's a different test.
That's a different test.
Oh, so you have a test for that?
It's a PET scan of the brain that we can do, which can
Early cell Alzheimer's.
detect early Alzheimer's potential, you know.
That's fantastic. See, all the great things you offer is amazing. Now, you predominantly started off as a cancer treatment center, correct?
Correct, yes.
And then you decided to go full comprehensive medical?
Exactly. We're treating so many patients. We said, why not try to help healthy people to prevent all these cancers that we're dealing with these days? And then after that, we get more and more into cardiology and other preventative services.
But also
Because
they
we
wanted-
have all the services on site. So
and they
why
wanted
not apply?
everything on site for their patients, so they didn't want to have to wait for Cedars or wait for another hospital or wait for whatever.
And then, getting up to the, going back to the cancer treatments. Now, one of the pronounced side effects after chemo is hair loss, correct?
Sometimes.
Sometimes they do, sometimes they don't.
Sometimes, yes.
But what I'm thinking, since you offer peptides, stem cell, exomes,
PRP scalp.
the PRP, you can also treat your patients that have cancer that had lost hair. And using those treatments, have you seen successfully them regaining the hair back?
So these days, we have the option of using cold packs for the hair to help prevent hair loss. So many times patients don't even lose their hair, even if their particular cancer treatment could cause hair loss, and we can prevent it with the cold caps during the treatment. So that's been helpful for many.
What's cold cap actually?
Just a cold cap is a freezing thing on your scalp that helps to prevent the hair loss from the chemotherapy.
Because what is it? Heats up the,
It cools down.
but from the chemo, it's heating up the,
With the chemo, I will have a harder time getting to the hair
got it.
follicles when all the vessels are constricted.
But you are offering the PRP for,
You do.
Oh yeah, yeah.
Yeah.
that's fantastic.
We do that, yeah.
And I gotta say, your whole team is incredible. Every 6 months, I come in for blood work. And I do, if I have an MRI and shoe, whatever, just to check, make sure everything's fine. And I gotta say, I show up, all my information's in the system. I don't even have a long wait. And within minutes, I have someone coming out to walk me in for the blood work, whatever. And your phlebotomists are amazing because I got these incredibly perfect veins.
You do.
And sometimes when I donate blood at like UCLA, they stick the needle in there, and then I come home and it's all black and blue, purple for days, right? You don't even see anything.
I'm very happy to hear this.
All your girls are incredible.
Excellent.
And they keep me busy, but they're doing it. I'm like, oh, wow, it's done.
Yeah.
So I got to say that, the operation, and I love the fact that in Beverly Hills, go to a medical center and throughout the heart of Beverly Hills, you got to go to a 3-hour free lot and walk over to the building. Your place, I know you have 3 levels of subterranean parking, 130 cars, valet. You pull in, walk up the steps, go right into the first area, which is the lobby, check in. It's incredible. For me, especially because I'm so busy, I love pull in, walk in, check in, go in, leave, and go back to work.
Great.
It's what you put together is an incredible operation.
Thank you. That's great to hear.
Yeah.
Now, when people now call, are you also doing like FaceTime, virtual consults? So if you have a patient that says, hey, listen, I can't come in, can we do a consult FaceTime?
Yes, we do it often. Yes, we do that for our patients.
We do it for our patients that are international, China, Saudi. We have a lot of patients all around the world.
Fantastic. Now, for instance, say you have a family, say it's a husband and wife, 3 kids, and they no longer want to have to go, make an appointment with the doctor, then go in. Can a family take like an annual membership and know that you'll address all their health and wellness needs?
We do. We also have a pediatrics concierge physician on staff. So we have all around wraparound care.
So it'd be like a package. So if they need a Z package of sore throat, or they something
It's
we
always
treat it.
something, yeah.
It's all inclusive.
Yeah, sometimes there's different tiers of membership, but sometimes it's included, sometimes it's not. Or if it's like so if you're a member, you get better rates. So if you want a house call, a specialty IV, you want somebody to come out for testing, you want access to the imaging center, you get more of a in front of the line pass kind of thing. And there's always a handler with you the entire time in the entire process.
Let's say you have a very high profile client. Do you do after hours for them because they know they're not going to want to be around?
We actually just did it yesterday. So they could book after hours. We had an MRI, X-ray after hours. We have all types of things. Or on the weekends, if somebody wants to come in, we can accommodate that schedule.
Okay, so that's a cash pay for we'll do all those things.
100%. Yeah.
Now, but you do have some of the testing that you accept insurance, correct?
We do take most insurances. We do ask that you call our center to find out if it's a insurance thing that you want to utilize. We ask that you have a physician order, or you could see one of our physicians and get a consultation with them to get what you want ordered.
Well,
So
it's
either way.
one-stop shop.
Yeah.
The key point is access. These days, it's very hard to get easy and quick access to testing, to doctors, to consultations, and it can take weeks for someone to figure out what is it that they have that they may have. So for us, it can take days, much faster to get access into the system for the blood test, for the doctor consultation, for the scans, for any biopsy that may be needed, much faster than otherwise.
People in that work, surgeons and specialists, I won't name the hospital, but hospitals around us, they'll call us for access for patients because they can't even get them in their own system. It's like crazy.
I think it's on La Cienega. It's called Beverly Hills Imaging. And they do x-rays and MRIs and ultrasound scans. And I remember a friend of mine had gotten hurt in a motorcycle accident. And it took almost a month
Oh, wow.
to get the MRI. And he was in excruciating pain. And he kept calling, sorry. I mean, to wait a month? I know with you, you'd be able to call up and get it within a reasonable amount of time.
That's weird.
I mean, that's why I love about your facility is that you don't have this long wait.
No.
And your place, how many square footages?
We have 33,000 square feet in the building,
Right.
and we use most of it, not all of it.
That's amazing. And you have 3 floors, correct?
Yes,
Yes.
we have 3 floors, yeah.
And do you have other doctors in the other levels? What's going on as far, where are the doctors in 1 level or 2 levels? What's the...
Our doctors are on 2 levels.
Okay.
On the 3rd level, it's mostly administrative, plus a couple of other private doctors who use the space.
That's fantastic. Yeah, because I like coming by and visiting Hannah and Ari and Sherman, and I'll come visit you too. Anytime bringing that chocolate cake from Rich.
Anytime. We love that.
No, but I think it's fantastic what you're doing because I have a concierge service. It's called Beverly Hills conciergeservice.com. And I've had the contract with all hotels, from Hotel Belair, Beverly Hills Hotel, Waldorf, you name it. And I'd be the one arranging for trainers. So it's the golf pro, and tennis pro, trainer, Pilates, aquatic instructor. Someone wants to go for a hike, want to go water skiing, do you want to go surfing in Malibu, you want to go horseback riding in the canyons. I arrange all those things and have a team of people that do this. And so it's sort of online that we should start working together.
Absolutely.
You can handle the medical side, right?
Absolutely.
Because I have the access to every hotel, all the chef concierge,
Very nice.
all my friends. Now, it's so funny, like a boss. He's a chef concierge at the Beverly Hills Hotel. I met him when I was 20 years old, and I walked into the Hotel Belair. I was this, buff guy, was competing in the contest, and shredded, had longer hair. And I walk in to the concierge desk. I said, "Excuse me, I'd like to speak to the manager." And he goes, "Do you have an appointment?" I said, "No." He said, "Would you like to talk about?" I said, "Well, you got a beautiful gym, but you don't have any trainers. And what good is having one of the world's most magnificent gyms and one of the world's most magnificent hotels without showing people how to use the equipment?" And so he goes, "Well, I don't know if you don't have an appointment." And then also Trike Bowling, who was the general manager, came out. He goes, "Hello, sir. What's your name?" And I said, "My first name is mine's Frank Bowling. You make a complaint. Come in, young man." So we sat down. I was there for like 2 hours. He said, "You know what? You're absolutely right. we have this gym. I watch people trying to figure out how to use the equipment. You need a man like you. So he said, I'll tell you what, I have this royal princess coming in next week, and she wants to lose some weight, and I'd like to introduce you to her. I said, great. He goes, do me a favor. Could you wear like a polo shirt? Because those guns might scare some people away. And wear long pants because I had this great stiff quads and 20-inch calves, So I looked kind of freaky. But I didn't know her, but it was muscle lad, right? So sure enough, I come back, and her name was Madame Saoud. Saoud is directly under the gate.
Oh, yeah.
The royal. And so she was the mother of the king of Saudi Arabia at the time. And so I met with her. I went into her. She had the most magnificent presidential suite. And it's like $50,000 a night. It's breathtaking. And she said, please, come in. And she said, please, have some tea and figs that I have from my country. So right away, I'm like, oh, shit. That tea must be really seriously full of caffeine and figs. That's condensed sugar. Yeah. I don't, the caffeine I barely have, and that sugar I never have. So now, she gives me the fig, and I bite into it, oh my God, it's all this sugar. And then so I'm eating it, and I want to disrespect her. And I'm drinking the tea also. I was like this. I was trying to, I was like a junkie, And she started laughing. She goes, you must not be used to this high intense sugar and caffeine. So she laughed. So we talked. So sure enough, she says, I want to lose weight. I want to lose 30 pounds. I need to be healthier. I'm so heavy now. I don't want to walk. I love walking. So I said, well, I'm your guy. And she said, I'm going to make an exception because usually it would have to be a female instructor, but I like you. I like your eyes, good energy. I said, okay. So the very next day I show up and she goes, let's go for a brisk walk. I said, okay. So that morning there was a wedding going on and they had all the wedding party. So she goes like power walking with me in between the ceremony. And of course the security guards know she's the real princess. So, okay. So we go in and out. She goes, oh, this is a lovely way. The bride looks great. She keeps walking, and she keeps going back and forth away.
Oh my God!
As soon as I who's this woman, and they see her like going down the steps of Open Swan and come back. And then I came in. I had to do some movements inside, some core work, some stretching, and I did that every day. She lost a total of 33 pounds.
Huge.
Unbelievable.
Over how much time?
It was a total of about 6 weeks.
Very nice.
And I tightened up her diet. I told her what to eat. And when I did, I went to see the chef. And I had him put in the system, whenever they're preparing food, ease the salt, the butter, the oil, easy on that. Certain carbs, she could not have complex carbohydrates at night. Only lunch and dinner. So she knew what she ordered. So if she asked for it, she's not going to get it. She lost the weight, looked great. That turned my business into a booming business where I was getting so many requests. I had to get a team of trainers to work with me because I couldn't feel. I was having like 10 people want me to train at the same time. But it was so funny. And over the years, I've had the most powerful people from the Middle East only ask for me. And because of her, when they went to the king of Qatar, went to the Beverly Hills Hotel. And she had a nickname for me because she felt so great after I got her in shape. So she called me the Beverly Hills Healer. So the concierge, this is funny, Richard was his name. He goes, Mr. Torsha, we got a request from you. I said, yeah. He says, the king in guitar is asking for the Beverly Hills Healer. I go, who? You. I go, me? He goes, well, Madame Saoud told him how wonderful you were, and he only wanted you. So sure, I go to the Beverly Hills Hotel, and I meet with the king of Qatar now, and we're in this, and he had a translator, and he was talking about all this other stuff, and I said, well, can I see your blood? And in the current or blah, blah, blah. And then I look at the blood work, and the cholesterol, everything was off, the testosterone was low, estrogen high, everything. So I started talking to him about all the things they have to do. But then I arranged for a doctor. If I knew you guys then, I would have done it. And the doctor went through the blood work to let them know that we needed to do further testing, and some of the things were really off. So the doctor gave another blood work, and then I worked with him with the diet and exercise. So we would go down to the gym, and it was so funny was, they said he doesn't speak English. So think of this. I'm working with someone that I just met. He's the king of a country. He doesn't speak English. So I had to be very creative. So I used sign language. And then when the repetitions, I go like this, and then I have to count out the repetitions and the form and technique. So I did that for about 3 weeks. And in one day, he turns to me and goes, I feel fantastic. And he speaks in English.
In English.
I go, I thought you didn't speak English. He goes, no, I thought I'd have some fun with you. But he goes, I like how you got creative with the fingers and the hand.
Of course he speaks.
So I was acting like he was a mute, like this, right? And we became friends.
That's good.
And again, every year he comes out. I mean, this is really long. And he has me work with him and his children and his wives and everything. And so I've built these relationships. But what I wish I had at the time was someone like you and both of you to have access to my clients, because I could have really made a difference, because especially in the Middle East, constantly issues with asthma,
Yes.
diabetes.
Diabetes is common. Yep.
But here's what I've learned, what happens especially in the Middle East with the royal family members. Because you have the high rank, and like for instance, any like royal family member that stays at the Dalhousie Four Seasons in Worcester or the Peninsula or Mayborn, that's lower rank. Royal family,
The Beverly Hills Hotel.
yeah, you can stay at Hotel Bel Air, Beverly Hills Hotel. You cannot stay above Sunset unless you're high ranking. Then also, the high ranking family members marry within family. So you're the inbreeding.
Yep.
The third cousin, second cousin, third cousin. Because of that, as you know, you have liver, kidneys, other issues, diabetes, asthma, you name it, because you're now putting all the genetic diseases in.
Yep.
And that's some of the biggest things that's an issue, because they want to contain their wealth. They want to maintain higher ranking, higher wealth. And so because of that, that's brought on their health issues.
Correct.
And it's such a shame, because I had this one young prince, 14 years old, and type 1 diabetes.
Too bad. Yep.
And then at Cedars, you know how many times I had to get them on transplant list, heart, kidneys, liver. I mean, all the genetic flaws.
Yep.
So what you have is like priceless. You are so excited. You're offering something that's going to actually save lives.
Yep. Yeah. No. We are very happy that we have the ability and the resources to provide all these services to our patients, and fast, with very quick access and very quick turnaround for the results.
Now, does your website reflect all the services you offer?
Yes, we have a concierge website, we have an Optima imaging website, and we have a cancer site.
So
we're about to create a new home for the Beverly Hills Health Center, which is our brand, our overall arching.
So if someone wants to go to the main site, will it show them all the things that you have, or you have to go to each different site?
So if you go to the cancer center site, you have access to all three. If you go to the concierge site, you'll have also access and information.
So what's the concierge website address?
bhconciergehealth.com.
Oh, that's easy.
Easy, right?
Yeah, that's great.
Yeah.
So now, what is the next step? Do you want to do this as like a whole business franchise, like maybe do this at other locations? Is that something in the future, or are you going to just stick with your baby and just grow here?
No, be open. And right now we're going to grow here, and can easily expand it in the future to other areas. One concept I wanted to discuss real quick is a lot of us, or a lot of people, are really focused on wealth management. But what about focusing on health management? And the question is, which is more important? Is health management even more important than wealth management? And if so, why not focus on it? So I really want to let people know that, yes, I can manage your wealth very carefully, but who's managing your health in order to enjoy your wealth? So why not divert resources, attention, and time to your health management as much as you're doing for your wealth management, or even more? That's my message to a lot of people.
I think that's something that's huge, That should be a tagline underneath your company's name. Seriously, because it just makes sense. You prepare for the future for your health and wellness together.
I always say-
That's the ultimate.
Yeah.
I mean, look at Steve Jobs. He bragged about living on Coca-Cola and pizza.
Yep.
Okay, and I'm not saying that caused his
We don't
illness, but
You don't know exactly. But
You
it
know-
could have been caught early. It could have been caught early and it could have been cured. You're absolutely right.
so that's why we have to emphasize, especially like a lot of these tech guys are becoming billionaires overnight, right? You better be concerned about your health and have that health management team, you know, because otherwise, what good is having all that wealth when you're not gonna last a very long time?
You have to invest in yourself to invest in your health in order to use your wealth, right?
But I get to share what they did yesterday. It's so funny. So I took a picture of me, just my arms crossed, you know. I just picture me at my podcast studio. And I said, I gotta put a message out there. So I imposed this header and this little description, and then the picture of me looking, smiling and confident. And I said, your body is your billboard.
Oh, I saw that. It was great.
So what are you saying about yourself, right?
Right.
You think about it. It doesn't mean you have the perfect body, but people judge you when they first look at you.
100%.
I mean, I got my bit. Like I used to go in Beverly Hills Hotel photo bells. All my business was in it for the photo lodge, because they'd look at me and go, "Hi, you look great. Are you a trainer?" Even all the actors I've met, I had an event, so Kevin Spacey from American Beauty. I mean, I can go on Al Pacino. They all saw me and said, "Well, you look great. If I could look half as good as you,
Yeah.
you know, blah, blah." And that's how I got it. So I was like a walking billboard. So that's when I posted that. I had so many people that came and said, "You're right. You're right. That's your billboard." Especially if you're out there, as a fitness person, you better practice what you preach.
100%.
That's a statement, you know? And so I really love where you're going with the company. So we'll have to talk.
We'll talk.
But let's talk about, how we can do this together, because I think the packages is a way to go. Because like my clients, they give me all their credit cards. So how it goes is my concierge service, I can actually book it for them. I could just say, hey, here's their blood work. Here's a little bio on themselves. This is what they're looking to do. They'll be flying in on the 10th of March or whatever it is, and they're going to need some tests. Can you tell me what tests you're going to recommend and what the schedule would be and how much?
Sure, that's very easy.
And we could do it that way, because the packages is the best way to go. And I think the subscription
Yes, correct.
model is huge.
Exactly.
This way,
Membership model. Yep.
because here's the thing. If a person knows my family's safe, especially I have a father and 3 kids, and if my wife needs something, my son needs something, I can call Sunday night at 11 o'clock,
Yeah.
and I can get that FaceTime.
Yep.
And if they have to, they'll send a nurse practitioner to my home to make sure my child could be an infant, and they've got 104 temperature. Maybe it should be in the hospital, right? So I think having that, especially with high net worth people we out here today,
Yes.
they'll pay anything to know that they have
Yeah.
at their fingertip a medical expert at all times. Because a lot of times people just need someone to say you're going to be okay. Because I'd say a lot of times when we got requests, where I had to get a doctor to come in, they were having a panic attack.
Pretty much.
And they thought they were having a heart attack. And you have to have a professional that evaluate what's going on and maybe give them some medication or some herbal medication that help calm them down, because they don't know the difference between a heart attack and an anxiety attack.
Or sometimes indigestion.
And yes,
We could do EKGs at home. We could do a bunch of stuff. So
Right.
they call on us for anything. Clear me before I get on my private jet. Okay. I'll be right over.
I get all kinds of sometimes really strange requests. I remember this woman called me one time, and she had told me that she had a party the night before, and she had this puppy that was like this custom bred puppy. It cost her for like $40,000. And she goes, I had about 150 people in my house, and I woke up this morning, my puppy's gone. So I know you have a concierge service. Can you help me? So I pause. But me being Italian and from New York, I go, I'll come over, see what I can do. So I went over to her house, and she had the cameras and everything. I said, let's go through the cameras. Let me show me the system. give me some time. I got to go through it. So I tracked everything. I said, okay, now can I see your social media? And who are your closest friends? I want to see their social media. So I brought in some people who work with me. We went through it. I found the dog in 12 hours.
Who took it?
It was one of her friends that was high. She was afraid the dog was going to run out. A lot of people were drunk and stupid. So she was sleeping in, and she was going to bring the dog back, but never told her. So, of course, I solved the case. Got the dog, brought it back. And then all of a sudden, I started getting all these celebrities call me because their dogs had disappeared.
Oh my gosh.
But only in L.A.
Yeah.
You know, China's doing that for quite a while. I can't say her names. Really big A-list actors. And I started going, okay, this is enough now. Because then, people were saying, well, I got this guy. He screwed me out of the contract. I go, no. I'm Italian. I don't go there. Okay. You watch too many of the Godfather movies. So, I don't know. Have you ever got any really crazy requests?
Not really. Honestly, it's pretty much all medical related.
Right.
Yeah.
I guess it's me, right?
Medical related or pickup, like Fendi stuff, Louis Vuitton stuff. Like you're like yeah, or just like random. They think we become like their assistants because we're able to help with everything. Or Hannah, I can't get this. Can you contact someone? And I need to get into the studio, or I need to get into this concert. I'm like, what did I become? Like an overall concierge. So they'll call for anything.
Yeah, no, I get a lot of those. I just got something for a Taylor Swift concert. I got something for Tate in November. They wanted to have a meet and greet backstage. Center, 3 rows, the center. And, I get requests for it all the time. F1 all the time. NASCAR. Something. They want to go to the Academy Awards. We arrange for that. We can actually get you on the first floor when they have the Academy Awards, and you can sit there and have dinner with celebrities right next to you.
That's cool.
We do all that. That's what I'm known for.
Oh, cool.
But I want to really kind of nurture the on-demand medical. I think that's
Right.
the next big industry, like you said, and I love that health management.
Health management.
So these dogs thought that. Well, I want to thank you both for coming on the show.
Of course.
My pleasure. My pleasure. Thank you.
And I'll make sure we put on the show when we air it, your website, so people know how to get in touch with you.
Great. Sounds good.
Thank you.
Great. Thank you very much.
You're welcome.
Of course.
So if you have anybody you care about, you better forward this episode. It could actually save their life. And please go to YouTube and subscribe. Your support keeps the show going. And thanks for watching.